Prenatal genetic testing, to do or not. In the context of modern medicine, genetic counseling and prenatal genetic testing play an important role in helping couples planning to have children understand and effectively manage genetic risks. This article analyzes how to identify and manage genetic risks through counseling services and genetic testing. Genetic counseling is a process of providing information and support to individuals or couples about the genetic risks they could pass on to their children. This process includes assessing family history and personal health. Genetic experts gather information about the family's medical history and the couple's health to assess genetic risks. Education and decision support, providing information about genetic diseases, the likelihood of passing them on to children, and available options for managing risks. 2. Prenatal genetic testing, a tool for risk identification. Prenatal genetic testing allows for the detection of genetic changes or chromosomal abnormalities that could affect the child's health. There are two main types: screening tests, such as blood tests and ultrasounds, used to screen for genetic risks. These are not definitive but are useful in determining whether the couple should undergo more detailed diagnostic testing. Diagnostic tests, such as amniocentesis or chorionic villus sampling, which provide accurate information about the genetic or chromosomal issues of the fetus. 3. Managing genetic risks. After identifying genetic risks, couples can accept and prepare. In cases of mild or acceptable risk, couples may decide to continue the pregnancy with better psychological and health preparation. Medical intervention. In some cases, medical interventions like in utero surgery can be performed to address some genetic issues. Other choices. For high-risk scenarios, couples may consider other options such as using donor sperm or eggs, or even considering adoption. Genetic counseling and prenatal genetic testing are important tools that help couples understand genetic risks and choose how to manage them informatively and responsibly. The final decision depends on medical information, personal values, and ethics, requiring careful consideration and support from healthcare professionals and genetic counselors. This involves both advantages and disadvantages, and whether to proceed or not depends on various personal factors and specific circumstances. Below is an analysis of the advantages and disadvantages. Advantages: early detection of genetic risks. Testing helps in the early detection of genetic issues, allowing couples to prepare better psychologically and financially. Informed decision support provides necessary information to help couples make an informed decision about whether to continue the pregnancy. Timely medical intervention. In some cases, early detection of health issues allows for timely medical intervention. Reducing risks to the health of the fetus. Psychological stability reduces anxiety and uncertainty for couples, especially those with a family history of genetic diseases. Disadvantages: anxiety and psychological pressure. Information from testing can cause anxiety and psychological pressure, especially if problems are detected. Risks from diagnostic testing. Some diagnostic tests, like amniocentesis, carry small risks for the fetus, including the risk of miscarriage. Facing difficult decisions. The detection of serious issues can put couples in front of difficult decisions about continuing or terminating the pregnancy. High costs. Genetic testing can be expensive and is not always covered by health insurance. Should couples opt for testing? The decision to undergo prenatal genetic testing depends on family history and risk factors. Couples with a family history of genetic diseases or high-risk factors might consider testing more. Psychological and financial assessment. Considering the ability to cope with potential information and related costs. Professional counseling. Discussing with doctors and genetic counseling experts to better understand the process and consequences of testing. Personal views and ethics. Considering personal views on medical interventions and choices. In summary, undergoing prenatal genetic testing is a complex and personal decision. It requires careful consideration in terms of medical, psychological, and ethical aspects. Couples should thoroughly discuss with healthcare professionals to make the most suitable decision for their situation.